Hello, everyone. A very good evening, everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: benign prostatic hyperplasia, commonly known as BPH. BPH is the non-cancerous enlargement of the prostate, usually begin in the 50s in men, and which in many men cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and is the most troublesome aspect of this condition, as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can be tiring for patients and can make traveling or attending events such as theater or cinema rather difficult. A doctor, such as a urologist, can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us a renowned urologist, Dr. Sushanth Kulkarni, MBBS, MS General Surgery, M.Ch Urology. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He is the senior consultant urology and renal transplant surgeon currently practicing at Continental Hospital, Gachibowli, High Tech City, Hyderabad. Dr. Sushanth Kulkarni has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. So, over to you, Doctor. First of all, we welcome you to today's platform. Our first question, Doctor, for you would be:
Thank you.
what is prostate?
Yeah. Prostate is a part of male reproductive organ in a system, which is a small size, about a walnut size, with a routine. So it is just located below the bladder and rectum, and it occupies surrounding the urethra. And nothing, urethra is nothing but tube-like structure where from the urine passes from bladder to the outside. uh, and the main function of prostate is to produce ejaculatory fluid.
Right.
Yeah.
Right, doctor. Now that we are talking about a very important issue which arises in almost all the men, what
Yeah.
is BPH, doctor?
BPH is nothing but benign prostatic hyperplasia, which is a non-cancerous or non-tumor enlargement of a prostate, which usually begins in a fifth decade of life, and which causes obstruction to the urine flow, and causes obstructive LUTs, is also called as obstructive lower urinary tract symptoms,
Right.
more
So, what are the
common
causes
in
of
above age of 50 years. Presently poorly understood, but generally one is age, increasing age, and also hormonal changes like testicular functions or increase in androgen. Such hormones can increase in size of the prostate.
right? Right. So, doctor, what are the causes of BPH?
So, as I said, that BPH is poorly understood all over the world. So, the two major factors necessary for the onset of BPH are one is increasing age and hormonal changes or testicular function, as I mentioned previously.
Right. Uh, Doctor, now that we know the causes of BPH,
Hmm.
what can be the symptoms associated with BPH? How does the early stage look like?
Yeah. So, since the prostate surrounds the urethra, any enlargement of the prostate size causes obstruction of the urine flow. So what are the obstructive flow symptoms? Or mild symptoms will be that frequently patient will try to pass urination, and also night times they wake up multiple times to pass the urination. Sometimes very big prostate will have patients will have difficulty to start the urinary urine to pass, and also thin stream of the urination. These are some of the symptoms which occur. And sometimes because of this obstruction, patient may also have UTI, urinary tract infection, because of this associated obstruction of the prostate.
Right.
And
Uh, so,
and
doctor,
yeah.
the moment someone feels the issue of urinating, that the urination is being very frequent, what
Hmm.
is the first step he should take? We usually tend to avoid such things. What is the first thing one should do?
Yeah, generally patients, not only BPH, there are other number of causes which causes frequency of urination, like diabetes. So they need to see the specialist urologist to evaluate further cause of frequent urination. So urologists will check them and evaluate them with certain tests, ultrasound or uroflowmetry tests. Different modality of tests are there to diagnose the prostate, and also they will do a digital rectal examination to check the size of the prostate, and then thereby come to a conclusion whether how severe is the mild symptoms, or moderate symptoms, or severe symptoms.
Right. Doctor, what are some of the treatments which are available for BPH currently?
Yeah. So there are three or four modalities where BPH can be treated. Initial milder symptoms can be managed with watchful waiting. Watchful waiting means patient, we advise them, guide them to have their frequency, to have their water intake, or decrease consumption of tea, coffee, or beverages in the night. So with such modalities, patient can reduce their symptoms, watchful waiting. And patient with moderate therapy, moderate symptoms, they have there can be a, we can advise them tablets, different tablets available, which cures the obstructive outflow, which acts on the prostatic urethra and help in facilitating emptying of their bladder, which releases the obstruction with different tablets. And there are, and again in severe symptoms, again we can offer them minimal invasive therapy. Office based procedures are there where we do a cystoscopy and check the urethra and prostate size, and we give them minimal invasive therapy like urolift or rasium, water vaporization therapy. Newer modalities have come. And if the severe symptoms, patient like patient who have renal insufficiency, or there is an excessive retention of urine, uh, or recurrent UTIs, or any stone formation due to this prostate, any hydronephrosis, or large post-void residue urine in the bladder, we advise them surgical treatment like transurethral resection of prostate, or laser holmium resection of prostate, or other thulium lasers are nowadays available to treat, which are 2 days of hospital stay, and patient go happily, and it increases their quality of life later on.
Right. So, doctor, when is surgery recommended for BPH patients?
So surgical treatment, as I said, when the symptoms, medical, when patient fails the medical management initially, and patient doesn't want to take the tablets lifelong, and if the obstruction is more, if there is a renal failure because of the obstruction, and also urinary retention. Some patients with obstruction, they come with urinary retention. Urinary retention is nothing but with a full bladder. Patient will come with unable to completely void even a single drop of urine, with abdominal pain. They present to ER. For them, we have to catheterize them initially. Such cases, we recommend surgery for them.
Right. So, doctor, what is the first thing which we suggest the patients who have a? Firstly, we would want to know, can it be, anyhow transferred from generations? Is it hereditary somehow?
Yeah, generally, BPH are hereditary, but it's poorly understood. Anyone can have men above age of 50%, 50 years, they have prostate. But not all patients will have symptoms. If patients develop symptoms above a men age of above 45 or 40, they develop symptoms like frequency of urination, nighttime getting up multiple times of urination, if his urine flow is poor, and patient is having difficulty in starting their urination, and some patients they have decreased lack of sleep because of this waking up multiple times in the night, and some patients they avoid going to gatherings or parties, or sometimes traveling in a bus or even cinema halls, because they need to pass urine multiple times, which causes them anxiety and all other issues. Such day-to-day activities, it affects them, and thereby it causes decrease in quality of life for them. So
Right.
these patients
So
and all, they have to visit the urologist for further treatment.
right. So, doctor, for the people who knows that there is a family history of BPH,
Yeah.
uh, is there any way how they can protect themselves or save themselves from having BPH? Any day-to-day lifestyle changes or any health maintenance? What can be?
Yeah.
Are there any solutions basically?
Yeah, BPH is also associated with increase in weight and excessive consumption of alcohol, and other type A personality, like stress factors which they have in day-to-day life, and water management they need to do, decrease taking of tea, coffee, or beverages after 6 p.m. If people have a symptoms, milder symptoms, we advise them not to have such things after 6 p.m.
Right, right.
Yeah.
Well, with that, I believe our viewers are already interacting. I can see the first question coming from Sanjay, who asks, when is surgery? The same question again. When is surgery recommended for BPH?
So BPH recommended surgical. First, not all patients require surgery. So doctor will see them, evaluate them at what stage are the symptoms, whether it is mild, moderate, or severe. If milder are there, then we advise them watchful waiting, like water management, fluid management, lifestyle changes. We advise them. If it's moderate symptoms are moderate, then we put them on trial with medications, medications with different age group. We put them, and on the follow-up, if we still feel his urine flow is less, we alert them in the clinic with what we call as a uroflowmetry test, where we see the graph of the patient, how is he passing urination. If we feel that it is satisfactory and his symptoms are reduced with the medication, we ask them to continue medications for lifelong. And if in spite of this medication patient is having severe symptoms in spite of this, and he's not happy with the medication, his quality symptoms are persisting still, then we advise them surgery, such cases. So most common indication for surgeries, one is renal insufficiency, or any stone in the bladder, or his in ultrasound we called as post-void residue. We check pre-void and post-void. If his post-void residue is very high, which can affect their kidneys, then we advise in such cases surgery.
Right. Doctor, also tell us, can it be completely cured?
Yeah, the BPH is curable. It's one of the conditions which is curable. But medical management also, people will tolerate even lifelong, and medicines are safer. So there are different studies, multiple studies done over the years. So medications is safer, but they need to visit their consultant, urologist regularly, yearly, annually, for the checkup, whether how he's responding to the medication.
Right. Doctor, We have also heard that BPH is a form of prostate cancer. Is it true?
No, no, it's a misnomer. BPH is benign prostatic. Prostate cancer is different.
Hmm.
So prostate cancer is a tissue diagnosis. We what we before along with the evaluation of BPH, we also do a blood test called as serum PSA total, and urologists will examine the prostate along with that serum PSA. If they feel like that prostate is very hard, so if the prostate serum PSA values are very high, then we do what we call as prostate biopsy to confirm where that is a cancerous. Prostate cancer and BPH are totally different. So this is
Okay.
benign condition, that is a cancerous condition. So modality of treatment for both are very different.
Yeah. Well, I believe the myth has been cleared. And now we quickly move on to the next question, which comes from Sarthak Ganguly, who asks, are there any natural remedies for managing BPH symptoms?
As such, the BPH organ is a very big, I mean, it keeps on enlarging. There are no any other medications with if the symptoms are milder, then lifestyle medication, watchful waiting, it can be treated. But if the obstruction, like a physical obstruction, it is there at the bladder and prostatic, it is compressing prostatic urethra, then either medication or surgery is the one best treatment for them. There are no other medications or Ayurvedic. There are few other allopathic treatment. One is called as saw palmito, which is known to cause regress the prostate size, but it is not routinely available everywhere.
Right.
And
Doctor, the
even if it's
next
available, they'll
question.
be spiked with the heavy metals, which are very toxic to the liver. So I suggest viewers to not to consume any Ayurvedic stuff, because they are not approved or checked by FDA. Because these molecules or tablets, what we prescribe, they are approved by stricter norms, and on we do a number of trials before introducing them in the market.
Right. Well, that was the expert advice for today. And now the next question comes from Manoharan, who asks, is OAB related to BPH?
Yeah, OAB is nothing but overactive bladder component, which is a irritative component. So this OAB comes when there is a obstruction of that urethra or prostatic urethra, which hampers the bladder wall. So that bladder wall produces the inflammatory changes inside the bladder because of a chronic obstruction. So when the bladder is inflamed, whenever the urine collects in the bladder, patient will have a strong urge or incontinence. Without patient will not have a control to I mean, hold the urination. So they will have a very irritative symptoms. It is called as irritative LUTs. So BPH per se is not OAB component, but BPH and OAB are part of the outlet obstruction, what we call as bladder outlet obstruction. So it is
Right.
basically OAB is due to bladder dysfunction or inflammation of the bladder. For that, there are a few medication for OAB also, but we give that medication when patient post-void residues on the lesser side. Otherwise, if we add OAB medications to the already irritated bladder, then patient will go into the retention. So this can be managed with the urologist after seeing and checking up the patient what's best suitable treatment for him.
Right. Uh, Doctor, the next question is, so what is the best test for BPH?
So best test, there is nothing called as best test. So the first is the history is the main important aspect of the BPH, and And in that, we do take a history following with examination of the prostate, which is called as digital rectal examination, which is done by urologist. And then we prescribe them uh, laboratory test, serum PSA, and also we do urine test and ultrasound to check the prostate size, and uroflowmetry test to check how is this flow pattern. These are the basic tests which we can say that patient is having BPH.
Right. Doctor, the next question comes from Naveen, who asks, can BPH reoccur after treatment?
BPH treatment with medical management, there are different tablets also to reduce the size of the prostate. If they take more than 6 months, there are alpha blockers along with dutasteride combination, what we call. So they reduce in size, but irrespective of that, prostate can increase as the age advances in spite of these tablets. And with the surgery, once we do the surgery, if the surgery is incomplete by inexperienced surgeon, and if we retain some part of the tissue, then over a period of time, say like 15 to 20 years, patient can prostate can reoccur.
Right, right.
Yeah,
Also, doctor, we know that from one disease, there is always the possibility of, moving to another disease. It usually happens like that, like that. So, what about BPH? Can it anyhow, trigger any other part of the body or any other organ of the body?
yeah. So BPH per se does not affect their sexual function, but because of the symptoms of the BPH, patient will have a psychological issue with. Otherwise, BPH doesn't have any relation to the sexual function. Sexual function is totally different, which is with vasculogenic component of the penis blood flow and other things.
Right. Doctor, the next question is, can lifestyle changes help manage BPH symptoms?
Yeah, definitely lifestyle changes can definitely help BPH symptoms. So one is they have to reduce their weight, quit smoking, quit alcohol, and for milder symptoms like what we call watchful waiting, we advise them decrease intake of the water. If patient is having uh, nighttime nocturia, it's more than patient gets up more than 2 times of for urination, we advise them from 6 p.m. to reduce their water intake, and or not to consume tea, coffee, or beverages, beer, alcohol, and all those things. So if they manage with that, and patient can happily live with BPH, milder BPH symptoms.
Right. Doctor, the next question is, how is the severity of BPH measured?
Severity of the BPH is measured when patient is having renal insufficiency, when their creatinine levels are high, when the renal function tests are showing abnormality, and patient is having high retention of urine in the bladder in spite of the medically treated patient. And also patient develops any stones in their bladder because of this outflow obstruction, or patient is having recurrent urinary tract infections, and also patient have uh, not tolerate the oral medications.
Right.
So
Doctor, can the occurrence of BPH affect any other part or organ of a body, or can it cause any other disease?
yeah, so BPH, severe BPH will hamper the patient's quality of life. So patient will have to get up every day in the night, and there will be a lot of soiling of his clothes. Post micturition, patient will feel wet his clothes, and it will decrease his sleep. And next day, patient will not be very fresh to do his routine work. Patient will feel tired and lethargic next day, and the patient will avoid going to the parties, or patient will avoid going traveling to any places in a bus or going to cinema. This day-to-day activity can hamper them, so it will affect them. So if patient doesn't sleep, then it will affect other metabolic system of the body. At least for 7 to 8 hours, patient doesn't sleep in the night, then definitely it will hamper metabolism of the body. So
Right.
one that keep in the mind that BPH is yeah, if BPH comes, patient needs to visit their urologist for treatment. It is treatable and curable.
Right. Right. So, doctor, can stress trigger the effect of BPH anyhow? Can it, boost the effect of BPH?
Yeah, stress can trigger hormone changes or metabolic changes, which again acts on the hormone level, and it will increase the uh, prostate size.
Right. Doctor, also we know that water is the source of life, and it's one of the major issues in BPH because normally the patient would want to urinate again and again. So, is there any limit of water which we refer or suggest our patients to have
Yeah,
on a daily basis?
yeah. So like we tell them that they have to take at least 2 liters of the day, but the best
Mhm.
guide of the patient will be to check their urination color. If their urination color is white, then it means they are adequately hydrated. If the urination color is or straw colored or yellowish color, it means they need to consume the water. So at least 2 liters will suffice. But in patient with BPH, they need to have a water management. Like from morning till 6 p.m., they need to consume one to 1.5 liters of water or fluid, whatever. Post that, they need to consume not more than 500 to 600.
Right. Doctor, what can be the worst case scenario of BPH? Like if we ignore it for a longer time, what can be the worst scenario of it?
So if we ignore BPH, then ultimately patient will go into retention of the urination. That's an emergency condition where it can uh, affect their kidney, back pressure changes of the urine. It can cause stone in the bladder, and it can cause multiple urinary tract infection. Again, that infection can spread to the kidney, uh, and uh, and ultimately I end up in a renal failure. And over a long period of time, that prostate obstruction can hamper the bladder musculature. So the patient to pass urine, the bladder will have a pumping action, which is called as vesicoelastic property of the bladder, which is get destroyed. So by the time, if they delay the treatment, if the bladder is loses its vesicoelastic property, then it will cause a irreversible damage to the bladder. If that irreversible damage to the bladder, if we treat prostate, that time it's and the results will be much less favorable as compared to the initial diagnosis and treatment.
Right. Well, it itself sounds very scary. And I believe nobody would want to go to that stage. So
Yeah,
that is the reason why we always suggest our patients, please, please visit the expert in the initial stage. Do not prolong it. Do not let it go that further. Our experts are always there to help you out with the best advice. Doctor, it was a very, very interesting session and a very informative session today. Before
pleasure.
we take a leave, any take home note for our viewers who has watched us so far and who are still watching us?
Yeah. So people above the age of 45 years or 40 years, if you have the symptoms of frequency urination or delayed urinary symptoms, delayed passing of the urine, and if you're waking up multiple times in the night or frequent urination, please do visit your urologist and don't neglect it.
Right. Well, that was Dr. Sushanth Kulkarni for us. We thank you so much, Doctor, for your
Thank you.
valuable time. It has
Thank
been
you.
a very informative session for our viewers today. And thank you so much, viewers, for your
It's a pleasure.
excellent participation. We look forward to many more such sessions in the coming time. Thank you so much once again, Doctor.
Thank you.
For
Thank you.
more information update, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter,